Awesome. Well, thank you. Welcome everybody to our roundtable. My name is Lillian Ofredos-Rake. I'm a board member of the HBS Women's Association. We usually encourage people to put their HBS year if you'd like. You're welcome to. Usually these are roundtables are led by Jagruti, who could not be with us today, so I'm sort of stepping in for her. So I want to welcome you all. We have one more roundtable coming up for this season, so to speak, on June 12th. Jagruti is going to lead that. It is going to be on AI in healthcare. And then we're going to take a break for the summer and restart in September. On the healthcare front, we have some exciting news. We are working on a partnership, on a sponsorship by McDermott and Emery, the law firm, who are potentially going to be one of our sponsors. And they have their private equity conference in New York on October 17, I think, and they promised us an event dedicated to us on October 16. We're still debating. It's going to be in New York City. We're still finalizing the topic and so on. So watch out for that. This could be really, really nice. And we also have a number of people coming to us and proposing signature events on healthcare. So a few things are also in the hopper. And finally, we have a very active WhatsApp group. So I encourage you, if you haven't joined, to do so and to engage and contribute your ideas as well. And if any of you have any ideas for, a roundtable topic or a signature event, and signature events are like one-off, more speaker, more formal, reach out to either Jagruti or I, and we're happy to work with you. So welcome all. I'm going to turn it now to Ana Kertesz, who's going to take it over from here. She's going to lead the session. Thank you.
Thank you. Good morning, everyone. I'm so excited to see some familiar faces and excited to see everyone joining. I think these roundtables have been a great way to stay connected and keep collaborating on themes that I think are very common to all of us. The idea for this roundtable actually was an initiative by Meredith, who is one of the two speakers today. We had a roundtable about 2 months ago on women and longevity, and I think one of the key topics that came up towards the end of the discussion that was very common to most people who attended was the question about community and how that relates, let's call it scientifically and experimentally to longevity and vitality. And Meredith and Sarah, who will introduce themselves momentarily, have given amazing talks together on the topic and have both not only had a personal connection to community and longevity and vitality, like many of us have in the topic of women's health and longevity, but they've also done many talks together, including at South by Southwest, and have both built incredible business around that topic. So hopefully we'll have an incredible time together. We want to leave about 20 minutes in the end for everyone to have a chance to ask questions. We have framed the conversation sort of in 3 parts. So they will share a bit about their background and how they got started on this and the incredible work they've done. They actually put together a great presentation to share some of the more sort of core scientific and experience aspects of the conversation, and then we'll talk a little bit about an action plan and hopefully key takeaways that you can take from today's discussion, framing not only individual lessons we can have, but also in the framework that most of us are either executives, investors, founders, or just explorers in the space, looking for, I guess we all love an action plan. So as a very quick background, the focus today obviously is Meredith and Sarah, but my core day job is I'm a partner in a private equity fund called 4x4 Capital. It's a mid-sized focused private equity firm. I'm building the consumer health practice there, but our core focus is consumer goods and consumer services. So I'm looking at food, beverages, fitness, different aspects, and trying to bring in consumer health also to disrupt these large-scale businesses. Our check sizes are between $200 and $600 million. So if any of you have ideas of awesome businesses in consumer, follow up with me. I also have my own investment fund focused specifically on women's health and longevity. So I make smaller pre-seed investments in the space. And I have, through Linda, who is here, who is an awesome person, she connected me to the team who is leading some of the advocacy initiatives for women's health in DC, and I'm getting more involved with that. I'm just very, very connected to all of us making a big dent, hopefully, in women's health. So with that, I'll turn to Meredith and Sarah, and thanks again, everyone, for being here.
Thank you so much, Anna. Such an impressive background, and we're so grateful for this opportunity. Sarah, if it's okay with you, I'll share my screen, Perfect. And then we can do our intro stories in that context. Okay, so just quickly want to say we work hard and play hard. Sarah and I have had overlapping careers in the industry of senior housing, which we'll both talk about, and are advocates and supporters of various different causes, supporting overall health. And this picture here is a little fun one from an event that we're both passionate about in the area of brain health. Okay, so for both of us, it's personal. And I just want to share quickly that I've been doing this work in the area of keeping older people well since I was in high school. I made my grandparents' longevity my priority and started my work with older people when I was a teenager. And so it's very personal. I'm very passionate about this. It wasn't until, here's my dad, my father, who was dealing with 2 blood cancers and blood diseases, was fighting for his life, that I realized that my 25 years in the industry of senior housing was for naught, because he was never going to get there. My mom never wanted to be there. So I decided that I needed to take a different and better approach. And rather than wait for people to be sick and hopefully wealthy enough to afford senior housing, how about keeping them where they want to be at home and how they want to be well? And so that was my impetus for doing the work on Vitality Society, which I'll talk more about. And after my mom here on the right survived caregiving and cancer of her own, I decided that rather than be threatened by her, that she'll never move into senior housing, focus on providing a community of her own where she can stay connected and well. Sarah, for you?
Oh, Meredith, first of all, it's so fun to do this with you, and very excited to get involved actually with the HBS Women's Association. So I'm looking forward, as this evolves, to be doing more with this group. I'm a 93, by the way. Wasn't sure how to change my date. Gosh, this, I think we all have our personal stories, and most of us have started businesses or are working in areas of passion. In fact, Meredith, if you don't mind, we can even pull the slide down for a second. I can tell the story, and then we can put it back up just so we can see each other's faces. But my path has been a fairly non-traditional one. From the time I was at HBS, I was the unicorn. So dating myself back in 93, I think we had, 25% women. I was also an English drama major, not many of those. And I had written my application saying I wanted to do social impact, which wasn't really quite a theme or an area of focus yet. And my entire career has been that unicorn social impact path. Right out of HBS, I wrote the business plan my second year for AmeriCorps. For the Domestic Peace Corps, and served in the White House for 2 years rolling out AmeriCorps. I'm very involved in the service world, and many of those players and partners are still part of what I work on today. And I think, as you all know, about 5 million youth have served the country, and we probably all have organizations taking advantage of that. I started an education company when I left the White House, but again, non-traditional. I was really focused on time and learning and working with a lot of students who were not in the wealthier neighborhoods. So we had inner city Baltimore, we had inner city Newark, we had police athletic leagues, Bastrop, Louisiana. We were really trying to bring a time and learning, experiential learning program to the market. But where Meredith and I met since 2007, I did my next jump off the cliff, and I've been in healthcare and brain health and longevity since that time. Back in 2007, which is where we overlapped, I felt like we could really connect and bring community to seniors. And I was really concerned about the isolation that so many of our families and seniors faced. My grandmother at the time was facing an Alzheimer's battle, as so many families are facing. And so my partner and I decided we would connect an aging population, and everyone thought we were crazy. And so Connected Living overlapped with Vitality Society. In the end, I guess we weren't so crazy. We were in about 6,000 properties. And of course, during COVID, we became an essential service, mobile apps, digital signage, robotics, et cetera. So I love to talk technology. I love to talk investment in health. Community does matter. Engagement does matter. Family does matter. But maybe the most important piece of the story is none of that. Along the way, about 5 years into starting my second company, my husband was diagnosed with early onset. And so my kids were 10 and 11. That handsome man you saw at the middle of Meredith's picture, he looked that young when we lost him. We faced a 10-year battle. And while I was literally working in thousands of properties, we, in the very end, couldn't safely keep him in our own home. He had about 4 words left, and my kids and I faced that during the pandemic. And sadly, we lost him a year ago. So to say that this is a topic that I feel with every fiber, and that I've been a part of in every fashion, you can be in an industry and think that you know everything and have read all the science and been part of it and serving hundreds of other families. And then when it's yours, Meredith and I can attest, you know so little, and you need community and you need help. We will get there in our presentation, but my life right now has 2 components. One is a global nonprofit, which we'll talk about, focused on brain health and longevity. That's a global consortia that I hope everyone is a part of. And the other is a company called Everyday Matters, which is about taking epigenetics and living our best life and creating products that are brain healthy and focused on longevity. So that's my why and my passion around this, and my deep pleasure of working with Meredith, because she is just like the twin I had never met until 2007.
Wonderful, wonderful. Thank you, Sarah. Your story is always so touching. It brings me to tears every time I hear it. So thank you for sharing that. So Ana, if you're okay with it, I'll jump right into framing the problem.
Amazing. Yes, let's jump right in.
Okay, wonderful. So here's where we start, and I think it's a really important point and probably drives a lot of us on this Zoom today. So there's no question that the US is facing a healthcare crisis, that we're spending 2 times more than the average of other wealthy nations, with the lowest declining life expectancy. So with all of our training, you would think put money in and you'd get a better outcome. And that's not necessarily the case. And it's certainly not the case for healthcare in this country. And so these very challenging consequences that we're dealing with, particularly going into a generation of older people that have rewritten history every step and stage of the way. And now the question is, if the system is already struggling and not working, and we're in decline in terms of our peer countries and our life expectancy, how do we turn this around? So really what we're here to talk about is community and connections. So Medicare has quantified the cost of social isolation of being $7 billion annually. This is a real problem and thus a tremendous opportunity, something that Sarah has addressed in various different facets of her career and I have as well. But the question really becomes, what do you do about this? The country also, as we all know, has waged war on social isolation, being more deadly than cigarettes. And our Surgeon General came out with that declaration that this is a crisis of our time and affecting every age person, and particularly older people. So social relationships are essential to well-being and good health. There was a meta study done looking at 90 cohort studies of social isolation, loneliness, and mortality. And the data is quite disturbing. So social isolation increases overall mortality by 30%, as well as various different diseases in considerable ways. So cardiovascular disease, breast cancer, et cetera. So there's no question that the healthcare system is broken and isolation is detrimental. So Sarah, I'll pass to you as it relates to the meta picture and mega picture here.
Thank you, Meredith. You know, I think that when we think about a moment whose time has come, and you just said it so well, the North Star, we are really in a moment. If the pandemic brought us anything, because we know it certainly brought a lot of pain and a lot of isolation, but one thing it did bring us is an intense focus, I think, globally on brain health, on dementia, on neurodegenerative diseases, on mental health. And I think this is maybe one of the gifts, because people are actually grabbing on to the fact that this is our largest pandemic right now in the world. The increasing global cost of dementia, neurodegenerative diseases, and mental health disorders is unsupportable by any country. We have, and I think, you know, a lot of these issues were pandemics before the pandemic, but it shone a light on them, where the numbers and people's willingness to address, to talk about it, and to move forward to do something is really an opportunity. That's what I always like to think about in social impact, right? Is the double bottom line. We know there's a crisis, and what can we do about it? But the numbers are staggering. The global economic cost of dementia surpassed $6 trillion by 2030. The numbers are wildly underreported. My guy would not have been in the numbers. He, like many, refused to go kind of get treatment because there wasn't anything, right? So there's many people just suffering in silence and aren't recorded. We did donate his brain to the Harvard Brain Bank, and so he's absolutely part of the science now at his willingness. But truly, the numbers are going to double by 2050, and this is, again, unsupportable. And the mental health disorders, which are now at the forefront for our younger people, for our workforce, are expected to grow from 5 trillion to 16 trillion. So with all of that said, and as entrepreneurs at the table and Harvard Business School women, what are we going to do about it? I mean, if I were to wake up this morning and say, where could I do the most good? I would say brain health and longevity. But if I were also to wake up and say, where could I make the most money? Where should Anna be investing? Where can we put our time and our resources? I would also say the same thing. This is an enormous economy right now. The silver economy, and all of us beautiful women on this call, we care about our health. We care about our parents. We care about our kids. We are the purchasers. We are the influencers. And we have collectively, if you look at the 45 plus market, you look at the silver economy, we have the largest spending power of any group ever known. But it is projected that, you know, this marketplace and opportunity is going to go from about 8.3 trillion to 28.2 trillion GDP. Now that is just when you look, you know, obviously looking at the US, the global opportunity is massive. The health and wellness industry, again, is growing astronomically, and the longevity industry is reported right now to be valued at 110 billion and expected to exceed 600 billion by 2025. So as we wake up and think about, as we talk about the science, this is a hopeful moment. For so long, there has been nothing, and there is now movement. There's a reason that we solved COVID, is that people were forced to get together and do something. And this collaboration and community, I think, is going to be essential in taking advantage of and helping solve the crisis that we're in. So I'll turn it back to you, Meredith.
Thank you, Sarah. Yeah, we're going to go through some of the friction that exists and how do you be part of these trajectories in a moment. But I just want to start with, as Sarah was saying, this idea of where does community fit into this picture? And I like to think of it, I have a social sciences background from Cornell, and remarkably, I did this slide, and then I went to put my daughter to sleep last night, and she had Maslow's hierarchy of needs on her desk, which was mind-blowing. They were doing it in the context of the Holocaust. as a crisis that they were studying in her school. But it is interesting that our conversation at 10:45 last night was about Maslow's hierarchy of needs. So in the sense of this foundational piece of the physiological, right? Once we knew, and the pandemic, as Sarah said, is a great example of this. Once we knew people were sheltered in a place that was safe, had the water, had the food, had the toilet paper, then there was this sense of elevating themselves to the next tier of the pyramid. So this idea of security, employment, resources, health, property, what you have and what you need to succeed foundationally. Above that, and quite important, is this idea of love and belonging. And as a caregiver, Sarah and I both dealt with this idea of feeling alone. Are you alone? Who's with you? Who's going to help you? Who's been through this before? This is that sense of connection that's so vital as a caregiver. When you are not well, right, having a community around you sometimes is very valuable and meaningful. And so that is something that, you know, we think a lot about. As I had mentioned before, I come from the industry of senior housing and spent about 2.5 decades working for the largest owners and operators, overseeing billions of dollars of real estate. And ultimately, all the data and research that came back, what do people enjoy most and need most in senior housing is connection. They pride themselves and they enjoy themselves the most, and they value that the most. Again, not people who have dementia right now. When people are moving in, what they enjoy in life most is this idea of being with other people. So the love and belonging piece is where I started my work with Vitality Society, which I'll explain. So prior to launching the pilot of Vitality Society, I assembled people in living rooms across the country and did online surveys and tried to answer the question that was baffling my mind, which is, why did 90% of the people never move into the industry of senior housing? If people love the community and connection that they feel once they're there, why don't more people want to go? And those that don't go, which was my survey said, like, what do they need and want? And I distilled it down to these 8 principles. Again, I've always spent my career kind of working for mega companies, looking at the people. And now I was going to do the opposite. I was going to do a grassroots initiative to really understand authentically and specifically, what do these consumers really want? And I distilled it down to these 8 principles, which you can see. But the ultimate piece of this was, no matter where we were, no matter what we were talking about, what I was asking about, just people being together was vitally important. Hence, one of the 2-letter words, HI, meeting new people at the middle of this program that I came up with, which is the idea of these are our guiding principles. But there's no question that it's so valuable, and it was going to be the cornerstone of what I was going to do on Vitality Society, which I'll talk more about. But the idea was, we need to keep them connected. And then the question became, how do you keep older people connected? And what I realized was everybody shared the same desire and concern, which hinged on health. Provided I'm well enough because I'm well enough, until I'm not well enough because he's well, now that we're well, everything hinged on health. So I had this idea, how do we keep people connected and well? And that was the genesis of the Vitality Society community. Sarah, I'll go to you.
So this is, we talk about a hopeful moment. Again, having been so steeped in this industry, and when you think about health and you think about longevity, obviously our bodies are connected. So any condition you can think about, it actually does come back to the brain. Whether we're talking about the microbiome, it comes back to the brain. Whether we're talking about inflammation, it comes back to the brain. Heart disease, everything is connected. But there's one thing that is for certain, and nobody wants to be here. Nobody wants to be alive without a functioning brain. And many of us feel the rest of the body is there to keep our brain warm, right? Because and so we have figured out how to live longer, but we have not yet figured out how to live better. There is a very promising and exciting area of science in epigenetics. And it is really so hopeful. And it's where I'm focused on most of my initiatives right now. So within brain health, we are obviously looking at trying to encourage and invest in the science and the molecules, and have the pharmaceuticals talk to each other and collaborate, and the same types of things that happened in COVID to solve things from a science standpoint. But while we're doing that, 70 to 80% of our entire health outcome is actually what we do every day. It is our exercise. It is our food and our supplements. It's our sleep. It's our meditation. It's our purpose. It's our community, the people we're in.
It's everything we're doing on Vitality Society, Sarah. I'm sorry how to jump in, right?
Yeah.
That's exactly it.
It is all of those pieces, and it profoundly affects our outcome. It profoundly affects our health. And so in the initiatives that I have started right now, both nonprofit and for-profit, all of which this group can be involved in, we're focused in this area. So I'll first talk briefly about Social Impact Partners, which is a global brain health initiative. And within Social Impact Partners, there's the opportunity to bring together corporations, brain health scientists, education, particularly infusing young people, the nonprofit community, and to all find a place where we can have a consortium where people are safe to talk, to dream, to inspire. And our three kind of pillars are to basically innovate, and then invest, and then take action. So we have a couple of ways that we do that, and we can talk about them more later, but all of which people can be involved in. One is an Innovation Olympics. The Harvard Business School team was one of the winners in the first year on a food as medicine, tied with Dartmouth. Sodexo is now launching many of these programs. We're doing a massive global food as medicine initiative, and it came to a head with a big meeting in DC with global corporations, leaders in the field like Cory Booker and Senator Gillibrand and others who legislatively are working on these things, together with over 100 youth leaders to try to get them into our programs. We are also raising a fund. So Anna, something exciting to talk about collaborating in, whereas we look at it's really investing in the ideas that don't exist with a ready marketplace that already wants them. And the final thing we're doing is actually a series at Harvard, which we can talk more about together with the Future of Commerce Initiative, where we're bringing together corporate leaders in retail health. And so in the last one, we had Kroger's and Sodexo and CVS and Walmart. And, one of the visions is if we could take some of the world's largest companies and they could care about these issues, both in their product base, for their employees and their consumers, we could really make a very, very big difference. So there's many ways to get involved.
Wonderful. I want to go on the topic of nutrition as a piece of this, but I want to underscore like part of what Sarah is saying. We both approach community in a different way, right? So Sarah has spent considerable time, and I was a judge on one of the intergenerational programs that she did with the universities and the organization led. So it's important to note, right, that there are various ways that communities are addressing health as a crisis and an opportunity. And I just want to underscore that Sarah is looking at it intergenerationally, interdisciplinary way with various different companies spanning various different industries. And then, we have taken we're going to meet in the middle, as I always say, right? I'm going top down, she's going bottom up, and we're gonna meet in the middle. And I want to go to nutrition as part of this, as an important point. Sarah, I'll kick that part off, but I know both of us feel very strongly in this idea of nutrition being a vital piece of the equation. So let me share that. So basically, this is just a fun little picture. This is not a novel idea. Candidly, like when I said I started my work when I was in high school, I wrote this cookbook in 1988 called Snivels, Nutritional Snacks for Senior Citizens. My girlfriends went to the right to Candy Stripe and take care of sick people. And I said, there's no way I'm going to be able to do that type of work, not because I didn't care, but I wanted to take a different approach. And here we are today. So Snivels wrote the cookbook, was talking to a generation of people, frankly, of the Depression generation, and good nutrition was not something that was a priority. They weren't honestly that well educated, and they weren't really that motivated. I went with my mixer and my grandparents and my parents and would stand in front of senior centers, which at the time, frankly, was the area of community and connection in any municipality. And what I came to realize is people thought I was saying something interesting, and I was very interested in them. So they came, and I donated all the proceeds from this book to all these different charities serving older people, and won a Congressional Medal of Honor as a teenager for this work. So this is something I've been very passionate about for a very long time, but it's not a new idea. But the good news is this generation, and this is what our pilot has demonstrated, is more motivated and invested in their health and more knowledgeable and sophisticated than any has come before us. So there's a lot of potential there. Just quickly, Sarah will go through this in a different way, but the food as medicine movement is something that we think very strongly about and in our community, because we have created fitness, wellness, and enrichment programming. And in the vertical of enrichment, we have done multiple series for our members. We've done everything from plant-based medicine to food as medicine to cooking with plants, regenerative farming, everything to inspire and engage our community of people to be aware of the trends in food as medicine as a movement. So the idea is very obvious. You can see the Venn diagram, which is this idea of what types of food, essentially the way I see it, is preventatively keeps you out of the healthcare system, right? Where you could see food not to just be consumed, but to be very therapeutic in a way that keeps you healthy and strong. And that's something in the idea of reduction of diseases, prevention, and treatment. So it's everything from looking at heart healthy dietary patterns to reduce obesity, hypertension, heart disease, metabolic issues. And there's no question right now with all the drugs in the area of obesity management that this is going to change quite a bit. But there's no question about it, whether you're on a drug or off a drug or hopefully never need a drug. Food is a go-to resource, and food brings everybody together in a community, which for us has been wonderful. We've had lunch series, dinner series, and every speaker talking about gut microbiome and all the way into the brain health foods. So Sarah, I'll pass to you. Oh, you're on mute, Sarah.
Sorry about that. I think, it's just an intersection to this as we look at, again, North Star, the pillars of brain health. Everyone's got different pillars and we're working with everyone, but they're saying the same thing, whether it's the blue zones, whether it's any one of the brain health groups, the idea that social interaction, physical exercise, stress management, sleep, mental fitness, purpose, and your overall environment really do completely impact your outcome. And so food as medicine has been a very central piece of all of these. Food is obviously something that not only many of us have the opportunity to control, but also many of us don't. There's a whole health equity piece to this that we're trying to work on with the government and others, and the preponderance of disease in poor populations where you do not have access to the right foods. And this is where, even from our Innovation Olympics for our work at the Harvard Faculty Club with FCI, the Future Commerce Initiative, and our global consortium, we have so focused on the food, and the supplement piece of this is very big. One of the things that I'm doing right now in my company, Everyday Matters, is trying to unpeel the confusion around that supplement side of it and the food side of it, combined with all of these other pillars, so that people can have an everyday program. So once again, Meredith and my work are so complementary and trying to bring the big picture down to an everyday opportunity for people.
I love that. Okay, so we're going to talk a little bit about impact, and Sarah, we should definitely converse on this you attack me politely and decently, my way of going about it, and I can maybe hopefully look at yours with a different lens and help each other. But essentially, what I set out to do for the Vitality Society pilot was put community at the core, right? For connection, information, and motivation. And we have 4 pillars of the business. So we do coaching with best-in-class instruction, with leaders in their field, live classes on Zoom, small classes on Zoom. Ultimately, we'll get into the business of one-on-one consults, I hope. But this idea of concierge, so the concierge level of service at the moment is these daily reminders. And why that is so important is because you can't build community and connection if people don't show up. And we in no way, shape, or form intend to patronize people in any which way. We've tested it every which way, but people need and want reminders. What time is this class? When is the Zoom link? Everything. When I tap into kind of the background I have in operations, which is to say, I try as best we can to aim towards 0 questions and concerns per day that come into our email boxes. And truly, we do achieve that 99% of the time. So the idea of creating reminders and a concierge level of service, we always have someone on our classes that can assist them and support them. But it's interesting because my tech advisors, my husband, and whenever we were starting the business and I was making adjustments and I was so nervous that older people weren't going to be able to keep up with the changes, he said to me, they'll learn. And I was like, oh God, said the engineer, but it's so true. So we create these patterns and frequency of the way we do things, which gets people showing up, and the community has, as a result, been built. I'm very proud to say, and I'll go over this later, that our subscribers are renewing 95 to 100% of the time, month over month, and they're paying $30 a month or $300 a year. And some of them are coming 5 or more hours a week to be part of the program. The community that they've built is around the classes we offer. So anything related to the word program that we have, the women who do words, these women, I think last week we counted, there was like 15 people there. I think it was like 100 degrees or something like that in terms of advanced education. It was remarkable. And then the content that we have, we do a lot of our work is our experts that come in from the outside that we curate, but we also have our members teach each other in our Vitality University in a peer-to-peer way. And then the dream that I have is, how do you connect this all with some commercial component so that what people need and want? As a great example, when we did our food program, our plant-based chef was telling our members about all the newest and latest foods in terms of all these different pastas and different sugars and monk fruit. And then the obvious question, well, where do you buy that? How do you get that? What is that? Which brand? And so we try to facilitate that as best we can with links. But the idea of connecting that, the vision would include some sort of commerce component that ties it all together. And Vivek Murthy, our Surgeon General, said it best: by building more connected lives and more connected communities, we can strengthen the foundation of our individual and collective well-being. And on that, I'll pass to Sarah. But again, we just sit in the middle here, our community between wellness, happiness, and illness. That's how we look at our lifetime customer value in terms of optimizing the value of our customer over an extended period, decades of their lives, so we can take care of them. Sarah, I'll pass to you. Here you go.
Well, first of all, Meredith, I couldn't agree more with what you're building. And I think it's so exciting. And I think it's so well structured. And we do all need reminders and purpose and community. And, even just the humbleness of all of this to say that this is what we know and this is what we don't know, but let's at least bring to the marketplace what we know. So just
I also want to just mention, Sarah, a question that we should talk about in the Q&A is, when you're thinking of direct to consumer businesses, this idea of customer acquisition, right, is very expensive. And so we can grapple with that later, which is like your pathway of going through the Sedescos of the world, who were our providers when I was in senior housing, versus a channel going direct. So we can talk a little bit about that, because that's where the rubber hits the road and the dollars are spent.
Well, I think yes to all the above. Listen, in the moonshot language here, with what we're trying to attack, there can't possibly be enough of us working on collaboration, innovation, investment, and leadership. If every single one of us turned around with our superpowers to attack this truly global crisis, we will create change. And so, having mentioned it just briefly before, and I'm gonna dead stop in 5 minutes so that we can have the interaction, which is what we all want, is that, to think about what power each of us has. And if every government, every business, every family, every person could really embrace the pieces that they can do. When I say in the way, if everybody knew what I knew right now, the power, just to take the power of sleep and how my daughter and I interact, and the decisions she now makes, because she knows the profound effect of sleep on the brain, and that the only time the microglia can clean the junk out of our brain is after we've had deep REM. That means we have got to get that sleep. So making decisions now, like, okay, she's going to stay up till 2 o'clock to get the A on the paper. than actually miss your morning class at 7 a.m. because the sleep is actually more important for our overall health. Now, these are decisions we never would have made before, having pulled many all-nighters. But I think this idea of how we can collaborate and get together to really change things. So we've built.
Sorry, I just want to jump in and say I had a very similar conversation with my daughter last night, because I went to a Broadway show with one of my HBS friends, and it was very much like, what? No, we talked about that when I got home. But I also want to mention there was a news story that just came out that these bankers that were working very long and late hours, this one banker had a heart attack and died. And now the question of, to your point, working these long, late hours, is it worth it? And is it actually acceptable for companies to stress their employees in such a way that it's deadly to their well-being? Go ahead, Sarah.
So very simply, this consortium, the two things we'll talk about, there's all kinds of ways to get involved. And we have these 3 buckets of initiatives. One is just to become a member of the SIP's Global Brain Health Initiative. We can put a link in the chat. And it's an opportunity to get the up-to-date information, to be part of the sessions and that we're doing monthly on brain health. But also as corporate leaders, these Innovation Olympics that are bringing together. In the last round, we had 40 judges that represented all the top brain health clinics, major universities, and major corporations. So, when you think about people coming together from each of their different vantage points, technology was a very significant piece of it, as was the investment community. And so the idea is that these young people, as we create teams of young people from universities all over the world to focus on these questions. But then what do we do about it with the ideas that we then create? So 6 or 7 rise to the top. Well, we can do a couple things. One, we can change corporate strategy for the major corporations who are part of the Olympics. We're actually creating brain health centers of excellence within senior living. We're actually now creating food as medicine opportunities through Sodexo and other large food companies. We are taking these ideas, we're creating technologies. And so therein also lies the opportunity to invest. It's a public-private partnership in a fund that takes the ideas the youth have come up with. Harvard's idea, the Harvard team, it was a microbiome and the connection between microbiome and the brain. And a lot of the types of things we're going to be doing through science, which is not only generically what's good for us, but being able to go down to the personal level. AI is going to play a large role in this too, but also going down to blood tests, understanding our biome so that we can impact our brain significantly. We know that most diseases from any of the dementias, Parkinson's and others, inflammation is a major piece of it. The other thing that we are doing now, it's kind of novel and fun, is right back to our beloved alma mater, is we do have these sessions through the Future of Commerce Initiative. One of the professors at Harvard, Dan O'Connor, has partnered with social impact partners, and we're doing retail health, senior living, brain health and longevity, and bringing together leaders around these strategies. We have another one coming up in September that will have many of these large companies we were talking about at the table. Meredith, I do think that whether we're embracing this from our nonprofit philanthropic hats, which we all have, so I want to be part of a consortium, I want to be part of engaging youth, I want to be part of thought leadership, and that's in the nonprofit realm. But now what do we as Harvard Business School women take our superpowers and the companies we start and the investments we make to move this forward? And that's the work that I'm doing right now through Everyday Matters. And obviously Meredith is doing through her Vitality Society, which is so great. So with that, let's open it up to questions, and love to hear what you all are thinking about. And
let me just make one last point, and then we'll go into the Q&A. So Sarah has mentioned, I love absolutely the work that she's doing, and I've been part of it, went to DC to be part of it, and also judging the competitions. But I also want to mention that for us on Vitality Society, we've done what we've done as a demonstration, as a pilot, right? Because when you're part of multi-billion-dollar organizations, to make change happen, as we all know, because we've worked for those companies, is very difficult. And so for me, incubating outside the box, self-funding, and having this moment of my time, right, to figure this out and solve for some of this is really important. So for me and Sarah, this is where we're going to overlap, is to say, like, every corporation should have a strategy to help older people and the caregivers that care for them, right? There's no way that these companies should be missing this opportunity. It's a multi-billion-dollar one. And until Sarah's work and my work impact the thought leaders of organizations ranging from food and fitness and clothing and cars and travel, like every piece that touches older people, we want to make sure that these companies, like Sodexo being a great example, are on the leading cutting edge, so that they're aiming not just to serve this market, but to support the health and well-being of this country. Because it, as Sarah said, and I agree, it's not any one of our responsibilities, it's all of our responsibilities. And with that, I want to pause and go to Anna, who I'm sure would be happy to ask the first questions or moderate the other questions. So thank you for this opportunity for both of us.
Thank you, guys. I think since we only got 10 minutes, maybe we'll see what questions I got a list if no one has any questions, but maybe we'll see what questions the team who made the effort to be here today may have.
And also, if you can share something that resonates with you or you're doing in this domain, we'd love to hear that as well, if that's okay, if you want to introduce yourself in that way.
Any thoughts?
Hi, Michelle.
Hi, everyone. Thank you all, Anna, Meredith, and Sarah. This has been very enlightening. And, I just recently saw an interview with, I think it's Eric Schlosser. He wrote Fast Food Nation. Anyway, and I was thinking about food as energy. And one of his points is that, like, there's these 4 global food companies that create all the food. And I was curious where you stand on the food industry and how you may be working with global corporations to create food that maybe is less processed, more wholesome. And also because, in my free time, I follow the stock market, and it's hard to find a day where people aren't talking about the GLP-1 drugs and if those are actually a good thing for, the stock market seems to think they're great, but I'm curious where you stand on that vis-a-vis the food industry. Just curious about that topic in particular. Thanks.
Well, I'll give a short answer to that. There's much work to be done, but I think everyone's paying attention. And the fact that now food as medicine is a major topic everywhere, that didn't used to be the case 5 years ago. No one was talking about it. So that's the good news. There is lots and lots that needs to be done, and there are some people at the forefront. And so I think this encouragement as consumers, asking for something different, being empowered with the knowledge of what it's doing to us and our children and others, really will drive, because again, we know not just doing good, many of us on the call, that drives us, but also doing well. So if the consumer wants these better products and is asking for it, it will happen. I think some are taking a leadership role. A few that I could mention are, I've done work with Sodexo for years. They are taking this seriously. They serve 100 million people in over 50 countries a day. And what an incredible opportunity to say, how could we differently look at this, educate, serve, and feed people in any different, more enlightened way. And they're working very seriously with us. They're a big corporate sponsor in our Innovation Olympics. They're taking a lot of the ideas that we are creating and moving them into place in their different industries. I had some work with Kroger, who I've been very impressed with. We brought them into our session at the Harvard Faculty Club that SIP and FCI did, and along with others, and they've created a food rating system. And they're not trying to tell people you can't put the brownie in your basket because you're still going to, but that they're giving you sort of an overall rating, like your basket is about 80% good and 20% this other. And that's not a bad place to be leaving the store. Like, they're trying to create an information framework, and have even in our last sessions agreed to share some of these frameworks or technologies with others. So, it's the movement forward of what are the steps I could maybe take. How can I influence, but how can we as consumers really drive that? One very exciting thing that I'm pulling people together on is to do a pragmatic trial around epigenetics with food at the center, where we really show the study, do it in senior living, do it in a workplace, do it in a university. And so if anyone's interested in that, we are actually pulling together funds, and we have a consortia of players who want to engage in these trials. But the food is significant, and I think the consumer voice is critical.
I also want to add 2 elements in addition to what Sarah's saying, and I knew she had the answer in terms of the companies, but it's a great connection of where our intersection is, right? Because these companies will have these programs or have these technologies, but at the end of the day, what's the consumer experience? What's the customer experience? That is, older people have a choice. Do I go to Whole Foods? Do I go to Kroger's? Do I go to Albertsons? Right? There are many options. So how do you become the premier place and space where your concerns about your health and well-being are heard, and the information you're getting is something that's available and accessible to me? And that's kind of what we've been trialing, because what we have seen in our various food programs is, and no pun intended, there is an insatiable appetite amongst older people that they know they need to eat better to live longer. The question is the how. What products, what programs? If I'm not a GLP-1 person, I still am entitled to know and be cared for in a way that will nurture and support me in making better food decisions, because food is aligned with longevity. So that's the first thing. And the second point was, I did a big study with one of our leading nonprofit senior housing companies, and they introduced the most fascinating program in their gym, and they did something in their dining room about, you know, all the different icons, so people made better choices, which was very good. And what happened was, which I thought was so fascinating, and this goes back to the customer experience and this idea of connecting companies with various different behaviors and opportunities in the area of longevity. But what I saw was that people who were eating better, there was no feedback flow back to their physicians. So if they were eating better and they didn't have a doctor's appointment, they were over medicating themselves with blood pressure medication, is what we saw a few instances. And then it was the question of, wait a second, I now don't have this health issue. I don't need these drugs, but I need a doctor who's going to monitor me more closely, or remote patient monitoring to elude this data to my doctor, so that my medications could be adjusted, because that's the goal, right? To reduce the reliance on medication to be a healthier, stronger person. So anyway, it's just interesting when you are on the side of the business of this, integrating all of these systems so the customer experience is a good one and the outcome and impacts can be optimized. Deborah, back to you. Sorry.
My hand is moving all over. Hi. First of all, thank you so much. This is fascinating, and I feel like I've been drinking out of a fire hose. So, so many questions. I wonder, you've mentioned supplements, and by the way, the food is medicine. There are so many ethnic groups, you know, I know Koreans, and I was raised Italian and whatnot, where food and, you know, was always the center, not overeating, but what was healthy. But there's a equity issue, because so many people who are older have to cut back on expenses, and it's easier to buy, you know, cheap carbohydrates and things like that than the protein foods. So, and you mentioned supplements. So if you could marry, how do you approach both of these? One, supplements, excuse me. I've always been a believer, but they are expensive. So how do you approach supplements in terms of aging people and the issue of cost?
Oh gosh, Deborah, we need another 2 hours.
Another session. I know.
I think the first thing to say is thank you so much for bringing this up. You know, if we look at globally, we look at our country, poverty and illness go hand in hand, and it's not okay. And people can't afford. First of all, people don't have the information, even if they have the wherewithal, which we're trying to solve. But if you don't have the wherewithal, the opportunity, you know, the white breads and the mac and cheeses and all the preservatives and things that, you know, the things that are accessible to you, the numbers of disease are so much higher in areas of poverty, all these diseases, and they are related, from obesity to dementias to, so at some point we can talk all we want. And that's the reason I am also involving in our nonprofit collaboration, not in is the governments and the payers, you know, that the cost of what we're doing to the cost of what's happening versus the cost of being preventative. And actually, a lot of my work is right now not just focused on seniors. Seniors are the obvious, and we need to care and love for our seniors and have the best possible life. But this is a birth to death issue. what happens in utero, what happens to our kids, what happens in college. This is the everyday matters. The epigenetics is happening every day of our lives. And we have more control. The sooner we start, the healthier and better our outcomes. So it's a major topic. The supplement issue is a big one. I think there's lots of different things we're learning. I've been studying this now for about 10 years. I've been working with all the neuroscientists I possibly can. I'm also working at the cutting edge of the science. And there's certain things, there's things we know, there's things we don't know, but even something as simple, I'll use a simple one of the why not, right? Where if turmeric, which is massively anti-inflammatory and more anti-inflammatory than an Advil, and is used in many of the cultures where people live the longest and have the least amount of dementia, and we know inflammation is bad in the brain and bad in the body. We may not know all the things it's doing yet, but I can tell you I have turmeric in my daily plan, right? And so that's a big why not. It's a natural spice so there are, as the things we know, the things we don't know, and this ability to peel that apart for people, and our ability now to work with payers to think about how we can, there's some other, you talk about innovative companies. I think Instacart is on this. They are looking at medically tailored meals. They are working with insurance companies. There's people, as we start thinking about the business opportunity to do good and do well in this area is big, but the health equity is very significant, and corporate America can't do it alone.
I also want to add just quickly that on my to-do list is a proposal to a new supplement company for women's health. And it was founded by a gentleman who sold his company, which was in the protein, the collagen space. And now the next venture is in women's health, health supplementation. And to Sarah's point, starting everywhere from fertility to in utero, and then continuing with women. So this idea of, as Sarah has said, I remember like when I was going through my fertility journey, the physicians gave me a list of supplements that was this long, and it was cost prohibitive to go through fertility, and to think that you had to spend thousands of dollars on supplements is an increasingly challenging pursuit when you're spending thousands of dollars to conceive a child. So there are barriers that need to be broken, as Sarah had said, but for health equity. But the idea too is I see it proactively and preventatively, right? So the idea if you create a situation and could prevent diseases from occurring, then the cost of any one life to an insurance company is improved. And in senior space, and we didn't really go into this, but this idea of value-based care, I think we all are aware and look at the money and where it's flowing. This idea of like, how do you keep older people well at the lowest cost? Like that is a framework in healthcare that we're all striving and achieving. Are trying to achieve, and dollars are definitely flowing into those startups. I'm sure Anna's seeing a lot of them. Not so easy to do with all the hospitals and physicians and other challenges, but that ultimately, I think the system is trying to reset, and now we just have to execute successfully. Not so easy, but everybody knows it has to be a priority because the system as it is not sustainable. So with that, I'll pause. It's exactly 12:58. Anna, if you want to close this out, I'm so grateful for giving us this chance. Thank you. Sarah, it's delightful. Always good to spend time together.
Absolutely. Thank you all so much.
Thank you, guys. And I think if anyone has follow-up questions, they're fine to contact either one of you, right?
Oh, please, absolutely. My information is on here. Alice, my team has put this on here, put my email on here, and please LinkedIn friend me because I do pay attention to it. There's much to do together.
Sarah, do you want to put your email, or what's your best email? I can put it in the chat.
Yeah, I'll put it there. No, Alice.
Okay, good.
Yep. Yeah.
And I want to put a plug for the WhatsApp as well, if that's people prefer to communicate that way. That works as well.
That's
Lily, can you go over for us how to get on it? Because for some reason I don't know that I'm on your. I'm embarrassed to say the WhatsApp.
Alexi is the best person to do this.
Okay,
she's
I am the link right now into our chat. And
so if I'm on my WhatsApp on my phone,
that was my question.
Type in.
Great question. And I don't actually know from my phone because I have never used it from my phone. I only use it from the desktop version.
Alexi, I finally got on this morning. I've been trying to
Yes,
join for the
Deborah.
last month and haven't been able to. And this morning, for whatever reason, it worked. But it's easier if you download it on your desktop, download WhatsApp on your desktop, and then get in through the invitation.
Can I
Strange, there has to be a better user interface.
Can I make an alternative suggestion? I'm a very heavy user of WhatsApp. You just email to yourself the link that Alexi just put on the chat. Open your email on your phone. You click it, you will be automatically on the
Perfect.
WhatsApp. Yep.
Thank you, Anna. That's great.
So you can't, like, just to be clear, Anna, you can't go into the search of WhatsApp, put in.
No, you just.
Is it so weird?
It's an invitation link, so you just.
It's a restricted group.
Yeah.
Got
Because
it.
it's a private group.
Got it. I'm gonna do exactly as you said. I will do it the many step way it works.
Doing it right now.
Thank you, Sarah.
Thank you all.
Meredith, for such a wonderful conversation.
So
Thanks everyone who joined,
Yes.
and we'll see each other soon.
Thank you.
Thank
Bye-bye.
you.
Bye.
Thank you.
Bye. Thanks so much.
Thank you.